Okay, sorry about that, guys. And we're going to go ahead and get started now. Thank you all for joining. My name is Dalton Tyler. I'm going to be the host, as I just stated. Just to get things started, I'm going to go over some house rules. Everyone is going to be muted by one of myself or one of the other co-hosts. The reason for that is just for background noise and things. We want to be able to make sure that we're able to hear everyone that's speaking and presenting during the meeting. But that does not mean that we do not want you to be able to present or to be able to talk to us. So we do have a chat feature. It can be, you guys can access this at the bottom of the screen. It's going to be some times where I ask you guys some questions. And I also want you, if you have any questions, to be able to reach out to us. I have some colleagues that are going to be looking in the chat, looking to communicate with you guys. So again, thank you guys for coming. First, I'm going to introduce some individuals that are going to be on the call and talking with me. Again, my name is Dalton Tyler. I'm from Charleston, West Virginia, and I'm a part of Thrive. I have a good friend of mine, Matt Taylor, from Capital Physical Therapy and Fitness in Kanawha City, West Virginia. He's also going to be providing some professional feedback to us here. And then we're also going to have Tina Schaefer, which is out of Cleveland, Ohio, and she's going to be providing a software demo for us near the end of the call. So just an agenda on what we're going to be going over today. Overview of the topic is going to be the next slide. I'm going to talk to you guys why it's important, why I wanted to talk on it, and why I invited Matt to talk on it as well. Words of wisdom from Matt. Demo how to take action from Tina. Resources for follow-up, and I already went over the house rules. All right, adapting post-COVID. So the reason that I wanted to really talk on this is something that I've been talking about for months with a lot of my clients and local businesses assisting them in this area. We're all going through a transition and a new way of doing things, and we're adapting traits or we're adapting tools during this process. Possibly these traits we've learned during webinars from someone assisting us or tools that we've purchased to be able to invest into our business. Post-COVID is a very fluid term to me, and during this presentation, what I mean by post-COVID is post-quarantine or post-shutdown. These are the steps that after your business are taking that you're looking to move forward and really move on from post-COVID and move on to the new norm. The main thing that I want to get across here is I hear a lot of individuals say, you know, I want to go back to normal, or I want to go back to things and how they were, and that's never really going to be the case. I want us to take a step back and look at this and how we've adapted and learned during this process, and go to more of a, I can't wait to get back to show others how I've grown or to be able to assist others after this. So moving forward, first I'd like to start on a quote by Andrew Yang. It says, we're experiencing 10 years of change in 10 weeks. It doesn't matter if you're in retail, apparel, food, travel, organization, businesses, even beliefs have changed a lot over the past 10 weeks. And we can't expect them to go back to normal. We have to accept and embrace this change and be able to adapt as business owners or business advisors. And this is, also wanted to post something that I posted on Facebook about 2 months ago. Says post 9/11 was one of the most innovative times in U.S. history. Crisis causes businesses to take a step back and look at their daily processes and how they can become more efficient. Today is the day to automate and digitize your business. I'm saying this because it's a long process that we're going through here, and a lot of individuals really, you know, took it lightly up front. But as we go through this and we can work together, we can adapt and learn and continue to grow. My next slide, I'm sort of going to touch on how we've adapted now and also how we adapted during World War II and 9/11 and how our society embraces change and learns to grow. So what has changed currently? Consumer behavior. Everyone's doing business in a different way. Expectation from your consumers are completely changed. Individuals are looking for you to do business easier, to be able to do everything digitally. They want you to be able to communicate them through social media. You possibly have a business that created a Google My Business or a Facebook business page or invested in a website during this time, just to be able to speak to their clients and communicate with them on everything that's going on. Supply and demand. Supply and demand has been absolutely crazy during this process. You know, it started with the toilet paper, and then now we're into the meats. Supply and demand is something that again, it's a very fluid situation, and it's something that you have to keep an eye on. Travel, if your business, not just travel for leisure, but if your business requires travel, if people possibly travel to your city that you're in for certain things, like if you're out of Cleveland like Tina, possibly your business gets a lot more business during basketball season or baseball season, and all of those seasons, when are they going to come back? You have to be able to adapt to those types of changes. Unemployment rate is sadly skyrocketing. Job income uncertainty totally changes buyers' trends. Seeing individuals buying more necessity based, but also, genuine of the United States and what we are, also seeing individuals transform to invest into small businesses and really try and support those around us that they know are struggling. One thing that I think is very interesting is digital first to digital only. We've transitioned, pre-COVID, we were already a digital first, 2020 world society that we are in. If we can do something digitally, most of us prefer to do it digitally. But literally within weeks, we went to a digitally only, world that we're living in. Grocery stores and things like that were one of the only things open. And this was a statistic that I found interesting. 3 times as many Americans go grocery shopping online now than they were just 2 months ago. It just shows that's not going to change. Individuals aren't going to see an easier way to do things, a more convenient way to do things, and then just go back and do it the different way when this is over with. They're going to embrace that change and adapt to what they've done. And so, the first question I would like to ask you guys to participate in the chat is, what changed in your life during COVID-19 that you weren't expecting? I'm sure you guys were expecting, work life to change, weren't able to go out and see your friends, but there's tons of things that have affected us. So what was something that possibly happened personally or within your business that you were not expecting? As I said, this next slide, I wanted to talk some on um, troubling times and how the United States and the world has responded. So just I'm going to touch on a few things first. World War II, we had, jet engines. The first computer, 1943. Robots during 9/11 worked with police officers and firemen to be able to assist and save lives. It was the first time that's ever happened. Police and fire radios, they struggled and failed during 9/11, and that's something that we have improved and made sure that that was not going to happen again. Since COVID, we have rapid 3D printers that can print ventilators in 5 minutes. Stochastic optimization technology is the technology that allowed cities like in New York and struggling places to be able to their healthcare workers support them and allow them to be able to work efficiently, not overwork them. These are all things that have happened during struggle. It's just who we are as humans. When we get knocked down or things change, we adapt. Animals adapt as well. It's just who we are. And this is, I'm not asking small business America to, start building robots or 3D printers, but you have to adapt the change. You have to adapt what's happening in the world and realize it when you're coming back into working with your past clients or customers, that they have had changes in their life as well, and that they possibly like some of these changes and they're looking to implement them into their regular lifestyle. And one other thing that I would like to note is that a lot of these technologies, we didn't realize how important they were for 30, 40 years. When we had that first computer, how large it was, they didn't realize what they had. And I'm sure when Germany was struggling during World War II and found a new way to create synthetic oil, they didn't realize what they were creating. And that's something that we don't see now. We don't realize the change that COVID-19 has caused completely, and we're not going to see it completely for a long, long time. But we have to embrace that change and be a part of that change. And that's not just large businesses, but I want to empower small businesses to do the exact same. So you're probably saying how? There's a new normal. So definition of normal at the top. Nothing is going to be back to what it was typical before or what is expected. What is expected, we aren't sure. It's a fluid situation. All we can expect is a new normal. We can reconsider our business model. If you work in home services, possibly focus on outside services and not inside services. If you work in retail or apparel or clothing, start creating masks. Someone in my BNI, they work in, um, apparel and promotional products, and they started creating little webcam covers. And I think that's a brilliant idea. You know, s- focusing on what is relevant to individuals. Individuals are using webcams more than ever, and adapting your business, what you offer, the services and products is more important than ever currently. Offer online or no contact options. We've seen thousands of restaurants do that within weeks that had never done it before. Offer delivery services that they'd never offered before, no contact options at hospitals that never happened before. It's all to ensure the safety of their patrons or customers. And doing so allows you to open up and allows people to trust you and come back. Um, Moving to the cloud is something that I'm very passionate about for small businesses, because it's something that a lot of individuals get confused with. The cloud is just simply investing in other servers to be able to house your data that are out there. So you have your physical computer at your physical location that you have all your systems on, and that you have all your client data or processes. But can you access those remotely from your home, from your phone, from tablet, to be able to run your business outside of physical location? This is just one scenario where that happens. This could also happen, you know, a national disaster, flood, hurricane. There's tons of things that have happened where being in the cloud allows you to be autonomous within your business and continue running. Be prepared to scale. This is something that is so important. There are services, some of the non-essential services and some of the essential services that have completely scaled back, and some of them have completely not been offered for, you know, 2 months, at least, you know, 6 weeks. People need these services. They didn't forget these services. I didn't forget that I needed my hair cut when I didn't get it cut for 6 weeks. I wanted it cut. And when I'm able to get it cut, I went and got it cut. And we're going to see that with so many services that weren't able to be granted or fulfilled during this time. And if that you're one of those individuals, you can make so much of that money you've missed out on by being able to scale larger than you've ever scaled before, being able to be, you know, automate some of the processes that take up some of your time, and come back and be the most efficient form of your business you've ever been. And one thing that I would like to say is, if you implement new processes, new security services, make sure you update your policies internally, externally, client facing. Um, Communicate with the people within your business, outside your clients, and make sure that you're very transparent about what's going on, and you know, they will respect that when that comes back. And some examples of changes: restaurants here in West Virginia. We do have a dynamic crowd, some from West Virginia, some from Ohio, and surrounding states here. And in West Virginia, some of the restaurants have started opening, and it's a complete and totally different environment. You know, you're over 6 feet apart from another table. Every, you know, your utensils, your menu, you all throw away yourself. You know, you're giving your orders to someone with a mask on. It's adapting, but that's what they did to be able to get back in business as soon as possible, to be able to make sure that that they survive COVID-19 post-COVID. What it means post-COVID again is after the quarantine. Education. This is a conversation I've been having. Imagine if COVID-19 hit the world in 2005, when, you know, education, there wasn't many online classes then. Almost everyone was, you know, working on at an actual campus, and they had to transition and scale their servers and their processes for millions of students nationwide to be able to work online. It wouldn't have been possible. But thankfully for that technology, for online classes, it was possible and pretty seamless. Salons and barbershops, there's I love barbershops that allow online scheduling. It's very easy, but it's hard to find in rural West Virginia, or rural Ohio. But that's something that we're going to have to adapt. You can't have people waiting in a waiting room, waiting to get their hair cut and just taking walk-ins. You have to schedule people, ensure the safety, the least amount of people in your barbershop at a time. Healthcare. As I said, we have Matt. He works in physical therapy field. He's going to be talking some. He's adapted telehealth. Telehealth is something that I've worked in the past with past jobs, and it's a huge the healthcare is way on the front when it comes to digital and working with individuals and trying to make it easy to be able to be worked with as a doctor or physician or physical therapist, and that is just again amplified. People that have never done healthcare or telehealth visits have told me stories about doing them in the past month or so, meeting with their doctors, not having to drive, doing follow-ups. It's easier, and that's going to be something that's going to be adapted and continue to be a part of healthcare and grow within healthcare as we move forward. So another question that I have for you guys, I appreciate you participating in the chat. What ways have you prepared your business? If you work for a business manager, owner, what ways have you prepared your business to go back, possibly adapted new services or often offered no contact or online options? And I would like to pay note to this graph that I have here. It's requirements in order to return to routine activities. It's interesting because this is tallying over a million people in the United States, consumers in the United States. And you can tell that it's always been the availability to a vaccine is the most important thing. But as time has gone on, and we have realized how serious this is, that has grown. And individuals feeling that the government relaxing restrictions is at an all-time low on what is most pertaining to them going back to doing their routine activities. So to think that this is over with once you go back and you can go back to normal is something that I want to get out of our brains, and we need to accept this change and change with the world that we're around. Okay, I'm going to bring on my guest now, Matt Taylor. Matt, you can go ahead and unmute your mic. I've worked with Matt for a couple months now, known him for about 5 months. Matt is an amazing guy. He works at physical therapy. Physical location is in Canal City. And the first thing I'd like to ask you, Matt, is just to tell a little bit about yourself, what you do, and talk about Capital Physical Therapy and Fitness.
Oh yeah. Well, first, thanks for having me, Dalton. It's always good to get together with you, buddy. And yes, I am the owner and the physical therapist and personal trainer at Capital Physical Therapy and Fitness. I'm from Brooke County, West Virginia, way up in that tippy top northern panhandle everyone forgets about. But I'm the youngest of five up there, and I got a wonderful family who's still all up there. But I went to Wheeling Jesuit for undergrad and grad school, and graduated in 10 and 12, and been a therapist for 8 years now, and done a little bit of every kind of therapy. I've been an inpatient, outpatient, home therapy, and travel physical therapy, and kind of seen a lot of good, but a lot of bad too. And thought that I could really help a lot more people by having the opportunity to open my own business. So our mission is to spread the love of God through exercise and fitness. So that's exactly what I decided to do on in January. So yeah, we've been at it for a little bit over 4 months now, but no good time for the world crisis, of course, right?
Amen. And that is tough that you came, and I'm sure that's like maybe not a lifelong dream, but something that you've really thought about for a long time. And it was sort of bad timing, but we're going to go into some ways that you've adapted. Can I ask you, so since you were a new business owner, how did you take COVID, or I guess it was coronavirus back then when you initially heard about it?
Yeah, initially, I think it was back in December. Yeah, I heard about it over in Japan on some cruise ships, and I wasn't concerned or anything like that. We've heard of various conditions and diseases before, and they never really, it's kind of like the boy that cried wolf, but then the wolf came, and we all kind of got caught off guard by it. So and things progressed to the point where I had to close down my doors, not by force, just by ethics, for physical therapy amongst our field. And I was forced to try to create a new stream of revenue. And that's where I came into revamp my website and offering my services online, trying to reach people that I otherwise couldn't. So yeah.
Understood. So when we started to determine, or when our governor started shutting some things down, I know I've talked to you. You were deemed essential, but made the decision on your own to sort of shut down shop for your clients. What was some things that when you made that decision, when you knew that that you were deemed essential, but you still shut down? What were some things that you did to take initiative to still be able to see your clients and assist them during these times?
Yeah, so I was able to offer telehealth, and I knew exactly what I needed to offer to patients. I just had no idea how to legally and HIPAA compliantly, if that's a word, do that. So I reached out to Dalton, and we were able to totally revamp my website. And you can be a product of this thing and COVID-19 and the coronavirus, or you can choose to try to create products during this thing, so to speak. So that's what we tried to do. We revamped our website and we made it more available to our clients, and we are able to see people throughout the entire state of West Virginia and all the little back roads and hollers and nooks and crannies if they have the internet and they're capable. It's also enabled us to reach um, a type of patient who's the younger too, and is probably gonna have a great outcome too. We deal with a lot of elderly folks here around our immediate community, so it's gonna help us branch out and grow
Hmm.
for personal training and for physical therapy all as well.
Yeah,
So
something that I was thinking about, Matt, was just think about all the people that are in college currently, students in college for physical therapy that are working from home, working remotely, getting this practice, and how they're going to adopt it as many other verticals and professions into their profession and be able to adapt telehealth that much, quicker and make it that much more of the new normal. Can I ask you, you talked about the changes, the online scheduling, the, sending files through a HIPAA compliant software and things of that nature. Can I ask what your client's reaction has been? How have they taken these changes, especially that happening in such, a quick manner?
yeah, they're super impressed that I have taken the initiative to do that, and where a lot of gyms and personal trainers and physical therapists aren't really, they're not able to be open. Some are doing telehealth, but on a very, very low scale. So they're excited, and they're excited to learn that we can continue. They're able to continue to get care in their homes, and their insurance pays for it. They don't have to walk through the door. So yeah, they were impressed. As am I. I'm very
Hmm.
impressed with the time frame too, that which it took place as well. I from start to finish, I think it was a little less than a month. Like 3.5 weeks.
Yeah.
I totally redid my website. It took me 3 months previously to get my original website up, and also I'm able to have a lot of different methods of payment too, so they can take a card over the phone and they can pay me on the website. They can be led to a PayPal account. So the more ways you can get paid as a business owner, the better. And the website has enabled me to do that greatly too.
That's awesome. Uh, Let me ask you, last thing I want to ask you here, get your opinion on, is there anything that I know you've adapted a lot more than many people would at the same exact time, which is great. But is there anything that you're looking for possibly in the future? As I've been talking about, post-COVID really isn't post-COVID. When is post-COVID? We're no one's sure. So what are you doing maybe to adapt and continue to grow during these times and maybe the next, 2 or 3 months now that you're back open and running?
Yeah, we are back open, but we still have the option of doing virtual physical therapy online or in person. So I think it's going to be a great complement to our main product, which is in person physical therapy and personal training. But this COVID-19 thing, y'all, is here to stay for a little while. I like to think we're on the uptick of it, but I think the rain cloud is over us for, I don't know, the foreseeable future. And I don't know how many healthcare providers there are out there, but I think it's changed the way that we operate. And it's really simplified the fact that we don't need to see people as often as we think. And we're going to look to do things virtually. And people are going to automatically gravitate to the pages that are easy to
Mhm.
work and that are transparent and that are professional looking, which mine is now. So,
Awesome.
but yeah, we're looking to grow. We're looking to multiply locations and our online business, and it's going to help us to reach as many people as we can in West Virginia and hopefully other states too. I'm very open to all opportunities.
That's awesome. And you do have experience in other states, Arizona primarily. Um, But again, Matt, I want to appreciate you. I want to thank you so much for joining me. You're so well spoken, and you really are a leader in West Virginia. I appreciate you, man. And I saw that you were also participating in the chat. He was talking about his church has been holding, group events, Zoom events. I saw people talking about family Zooms. It's just crazy how it's transformed our lives, personally, spiritually, professionally. So just an example of that being yourself. Thank you, Matt, for attending, man.
Yeah, thanks. That's one of the best compliments I can get. Someone recognizes me, my relationship with the Lord. So thank you, and thanks for giving me the opportunity to come and chat. And I'm always thankful to get together with you.
Awesome, man. I'm gonna bring on another guest now, which is gonna be Tina. Tina Schaefer. She's actually gonna be taking over my screen and showing you guys her screen as she operates within a software, sort of showing how you can deploy that and the ease of it. A lot of people are sort of scared of technology or software, and that should not be the case. So Tina, you can go ahead and take over.
Awesome. Thank you so much. Thanks again, Matt. I want to touch on some of the things that you had mentioned, one of which was making yourself more convenient to do business with, right? You said you are now able to reach out to a younger clientele as well that maybe you haven't really tapped into, with the majority of your clients being the elderly. So I wanted to just touch point on his website. I want to show how easy it is to have his clients schedule an appointment with him. He has these easy buttons, there's widgets over here. I can easily click on the widget, see what services he has to offer just by scrolling down, and I can schedule right here. So it is easy for me to just hop in, see what time he's available. Some of our clients and business owners, when we meet with them, I'm going to say, I don't want people to see my entire schedule. So I want you to see what that's like. I'm not seeing Matt's schedule. I'm just seeing times that he is available for this particular service. So it's, just a comfort level for other business owners to know that their whole schedule isn't out there for everybody to see. It's still kept private, and you're able to make those changes. And then I would just, as a new client, fill out all of my information, and Matt would get a notification that I have scheduled an appointment. So we've seen how easy that is. I want to pull up another website, just a random physical therapy location that I have found. And I wanted to kind of just walk through this so you can see the difference. So in here, I can read about them. I can try to locate services by scrolling down, then clicking on one. It's not as easy for me to maneuver through. And then lastly, I can request an appointment and fill out my information, but now I'm waiting for a phone call at some point from somebody there. Hopefully when that call comes in, I'm available, but I can't guarantee that. So now there's a lot of miscommunication and back and forth. We want to eliminate that and make it as easy as possible, right? So I've shown you what it looks like for one of Matt's clients when they're, scheduling an appointment, but what does it look like for Matt on the back end? So I'm in My Thrive here. I want to just show you, I have my calendar pulled up, and Dalton's going to help me out here with a little demo, and I'm going to schedule an appointment for Dalton just to show you how easy it really is. I can click on a time frame, go to an appointment. I'm going to just go in here and select Dalton. So this is if somebody's calling you and you're on the phone, you need to be able to schedule an appointment quickly. Our phones are going to be ringing, right? We're getting prepared for that surge. So we want to be able to get on the phone and off very quickly. I'm going to schedule Dalton a Zoom here. I can write a message to him, make sure that time is good. We're going to just do over the phone. And I'm going to make Dalton pay for this. Time is money. So we're going to make sure that Dalton has to pay for this appointment. We're going to charge him $50. So back to what Matt was saying, this has enabled him to get payment many different ways through PayPal, Stripe, Square, with credit cards. We have several options. So it's easy for him to get paid, and there's no lag time. So I'm going to just you can see here I have reminders that are automatically going to go to Dalton a day before his appointment and an hour before. So now you've just eliminated the need for, maybe a receptionist calling somebody to confirm their appointment. It's done automatically right through their appointment booking. So that meeting is now scheduled. Then if I go into my inbox, this is another great feature that's going to allow for two-way communication. Not only are you able to see that they have appointments scheduled, but you're able to chat with them. So if there's anything coming up, I can see that I have appointments scheduled with him. He's confirmed in the past that that time works for a previous appointment. And I can say, can't wait to see you tomorrow. So again, this is a great way to then keep in touch with those clients. You can always refer back and see what time and day that communication happened. Easy ways for you to stay on top of your clients, stay, out in front of them, and make sure that you are easy to do business with. So again, that surge is coming. We can't wait for all of your phones to be ringing, but you have to be able to adapt and offer new ways of communication and booking. We can't just rely on those phones. If your business closes at 5 o'clock, we still want your appointments to be happening, and we still want your calendars to be booking up. So this is a great way, straight from the website and a widget, to be able to offer those appointments and continue to book up your calendars. So I want to just extend an offer for everyone out there. If you guys are interested in taking a deeper dive into some of these features we talked about, please feel free to reach out to the business advisor that invited you. They're going to be able to really take it down, walk you through step by step of all those features we talked about. So Dalton, I'll go ahead and send it back over to you to close it up.
Awesome. Thank you so much, Tina. I love that demo because it really shows a lot of different places of your client portal, taking payments, seeing what services are very common for your business. It allows you to create your own analytics, allows you to see your own market trends, to see how you're doing, what products are doing better post COVID, and allows you to adapt and grow and see where you need to grow. So as we've ran over a little bit, and I apologize for that. We haven't had any questions, but one thing I do want to ask everyone that's in attendance, we were all invited by someone, possibly myself, Tina, another business advisor within Thrive. Please reach out to them and let them know what you would like for us to touch on in the future during these webinars. This is our 5th webinar, and we've had individuals suggest topics, and we are looking to be able to assist you in any way possible. We allow resources. We have COVID-19 Thrive resources. We have Thrive blog that pertains business owners similar to Matt and other individuals talking not just about COVID, but strategizing and plotting on how to be able to be successful in the environment that we're in today. And again, you have that business advisor that invited you. Ask them, to be able to sit down and schedule with them. We have a demo assist team that can show you how to do these things. We have Thrive specialists. We are here to assist you guys any way possible. Just ask. That's all it takes, and that's all that we can ask for you guys. And lastly, I would like to thank Matt. Again, Matt, thank you for coming. Anyone, COVID does not need to affect your health, personal, physical, mentally. There are so many options out there that you guys can reach assistance. And Matt, he's working with individuals still today and has been the past 2 months with physical therapy and training. So if you feel that you have that need, I suggest reaching out to Matt or someone of his nature to be able to assist you guys. Thank you so much for coming. The next one we're looking to do is within about a month or so. Your business advisor will reach out to you guys. But I hope you guys have a good rest of your day. Thank you.